The most important thing that the patient portal does is allow patients to be responsible for what they put in the record, make sure that what they put in is complete. It allows them to have the information available to the practice before they arrive, so that their time in the office is minimized. And it lends a better degree of accuracy to the record.
Well, it starts from the beginning. It starts with the process of registration. We're trying to have our patient access the patient portal, so it will eliminate a wait time on patients filling out paperwork. We have PDF files now where the patient can download and answer more details, and also their insurance information. And once they go through the process, they go through intake. The patients that fill out the information online, we in intake verify that the information is true and correct. After the intake process, we put them in an exam room, and that's another thing that we like about waiting room solution, is that it changes. You have one where the patient has scheduled an appointment, it turns to a 2 in red when you know that the patient is done with registration. Then 3 is when we put them in the exam room, and then 4, the system will tell you 4, meaning that the patient has left. So it allows staff in all areas to find out where this patient is and what process they're going through. So we also like that as well. And then once Dr. Oliver, when he clicks that, or the nurse clicks it to a green, I know that the patient has left, and I will view and see if he has signed that note. Once that note is signed, a lot of times I can get my claim out of the door before the patient walks out of our office.
The billing cycle is shorter because you're able to submit a bill the day that you see the patient or perform the procedure. It's interactive with the clearinghouses, Gateway, EDI, clearinghouse. And then on the back end of billing, you're able to review and monitor payments, and being able to ensure that a proper payment is received, and finishing out the billing cycle. That entire continuum for the patient's first experience till the end of the experience is complete with the system such as waiting room solutions.
What we do with waiting room solutions, we use a clearinghouse, Gateway, EDI, and when we submit our claims, the computer automatically that day, as soon as we submit a claim, it comes back to us. We do not have to wait 24 or 48 hours to get an error code if there is an error on the claim. So that has helped us where we can correct the denial before it actually goes to the payer. The appointment reminder service is wonderful. Yes, with Dr. Oliver's previous practice, they used a recall service company, and they found out that it was not calling the patients, or the machine messed up. But with waiting room solutions, it tells us if the patient answered the phone and what time the patient answered the phone for that confirmation on the appointment. And another thing that we like about waiting room solutions, you can send in a ticket to support, and they will take our suggestions or ideas. I understand that they have a meeting, I don't know how often, but they gather all the information from other physicians, and they talk about it to see if this is going to work for, I guess, the users of waiting room solutions.
You know, we've had really good support from the customer service side of things. Generally, when we have questions, you know, we talk to Risa and Patty, and that's usually Rhonda doing that, and she's been very impressed with the helpfulness. You know, like I said, with especially with the routine upgrades, and the communication with WRS has been superior. Helping us with the meaningful use attestation, it was phenomenal.